So today we will discuss something about clavicle. So as you can see, this is the lateral end and this is the medial end. The lateral end is flat, and as you can see the medial end is large and quadrilateral. So there are three parts. It is the shaft and there are two ends. This one is the medial and this one is the lateral end. So the medial part of the shaft, as you can see, this part is convex forwards, and this part is lateral to third, and this part is as you can see concave forwards. Now if you see the inferior part, you will see here a groove. So the inferior surface is grooved. So now the clavicle belongs to the left side. So the shaft is divided into medial 2/3 and lateral 1/3. So the lateral 1/3, it is flattened from above downwards. As you can see, there are two borders. This is the anterior border of the anterior border and this is the posterior border. So the anterior part, the end, as you can see, the anterior border is concave forwards while the posterior border is convex backwards, and it has two surfaces. This is the superior surface and this is the inferior surface, as you can see. Now another thing to be noticed is that this is the conoid tubercle, as you can see, and there is a part called trapezoid ridge. See, this is the conoid tubercle, as you can see from above. Now the medial two-third of the shaft, it is rounded. As you can see, it is rounded. And there are four surfaces of the medial two-third. One anterior surface, one posterior surface, one superior surface, and another inferior surface. This part, this is the inferior surface. Now the anterior surface, as you can see, the anterior surface is convex forwards. The posterior surface, it is smooth. As you can see, if you touch this way, you will feel it to be smooth as compared to the anterior surface. Now the superior surface. The superior surface, it is rough here, rough in its medial part. Now another thing is that the inferior surface has a rough oval impression at the medial end. This is the rough oval impression. And another thing you should notice is that this is the subclavian groove. Now we will talk about the lateral end. The lateral or acromion end is flattened from above downwards. It bears a facet that articulates with the acromion process of the scapula to form the acromioclavicular joint. You can see this is the facet, this part. Have a look. The medial end, also called the sternal end, it is quadrangular. As you can see, you might have seen clavicle earlier. It is quadrangular. So the sternal end of the clavicle articulates with the manubrium sterni to form the sternoclavicular joint. This is the sternal end.